Moscow right now, and we're going over this situation that happened where you were in a car accident 2 years ago. Yes?
Yes, I have crash in car
Okay.
2 years ago, and have after not feel left side
Okay.
and cannot breathe.
You started to feel left-sided pain?
Pain.
Okay.
And here, all left side.
Okay. And all the way left side going down into your toes, correct? Hi, how are you? Thank you.
Very much.
Nice to meet you.
Nina.
Nina? Nice to meet you, Nina. Okay, thank you. So, from the car accident 2 years ago, we have left-sided pain, number one. Number two is the breathing.
Breathing and reflex all time after it.
Okay, so this is important now. This is her talking about what happened after the car accident. There's the breathing issue. Of course, with the breathing, there was a little bit of anxious or anxiety. But the reflux is the main thing and the most important thing here for you because it's affected so many different things in your life. Yes?
Yes.
Okay. Now, this reflux has been 2 years. You're managing it the best you can. You're managing it, right? But it's not fixed.
Reflex all time.
All the time.
Sometimes when I drink my extract, I feel better.
Okay.
But every time I have reflex every day, maybe one time.
One time every day.
Sometimes I eat one time because because after reflex sometimes I tired.
Okay.
And sometimes I eat only one time. If I eat 3 times, it's perfect.
So hold on. If you eat 3 times a day, it's okay.
No, it's perfect, but every time I'm reflex.
Okay.
Have reflex.
So the reflex is there. Okay. Let's go ahead. We're going to do your examination on your back. Let's see what we find. Okay?
Okay.
All right. Let's do it. So the first thing we're going to do is let's run a meter on her back. Let's see what's going on. Now, we've already looked at her images and her x-rays. Can you put this on the top for me, please?
Okay.
And this is important, guys. And why this is important is this is her. She didn't have any of these symptoms before the accident. So there was some sort of structural thing that happened that caused a functional imbalance, and mainly a physiological imbalance. There's pain, but there's also this physiology that's going on, which is maybe a little more important. Why? Because one thing you can manage, it's easy to, I shouldn't say that easy, but you can manage pain and work around it. But when you're dealing with digestion, and for her or for anyone out there that has digestion issues, knowing that you're going to have reflux after every meal, you don't get a lot of confidence then when you're eating. Does that make sense? Does that make sense?
Yeah.
You don't have that confidence, so we want to develop this confidence. Can you explain that to her?
Ты не чувствуешь себя так уверенно, когда, после каждого приема еды ты чувствуешь себя некомфортно.
Да.
So let's look here, and the first thing we're finding, check it out, is we're getting about 15 points of pressure, C1 on the left. Okay?
С левой стороны 15 меток.
Next thing we're getting
Давление.
is around T6, 12 points of pressure, T6. Okay? Now,
Difficult for breathe.
sorry?
Difficult for breathe.
For breathing.
For breathing.
Okay. So we have left-sided pain, we have breathing issues, we have reflux. In terms of the nerve pressure, we're getting up top C1, T6, and down low S2, S3. Okay? 1, 2, and 3. Next thing we're going to do is we're going to check motion of her pelvis. Scoot, no, you're good. Feet together.
Ноги вместе.
Okay? Open your knees, close your knees.
Колени разводите и сведите.
Bring your feet a little bit closer. Okay? So right now you do both. Then I'm going to say right, do the right, and then do the left. So right now do both. And what I want you to do is watch my thumbs here. So we already know the left side is high, the right side is low. You're opening both legs right now?
Вы обе колени разводите, да?
Okay. Now do the right side only.
Только правый.
So when she does the right, the whole left wants to shift with it. When she does the left, the right moves too, but not as bad. So what I'm finding is S2. Is that painful when I push?
Больно?
Yes.
Yes. Now, let's do the left SI joint. Top of the joint, come back towards me. Middle of the joint, or more pain at the bottom here, or more pain at the top here.
Сверху или снизу более больно?
This one, or this one?
This.
Right there at the bottom.
Yes.
That's what I'm feeling. So I'm feeling it at the bottom of the SI joint inside. It's a little swollen. Now, when I go from the dimples here, 2 inches lateral, 3 inches inferior, and I push here, and then I push here.
Okay.
You feel the left side more, yes?
Yes.
We have an AS potential ion ilium on the left side, and we have an S2. Let's go ahead and statically palpate her spine. Now, go ahead and bring your head down, down, round your back. Okay, and you want to see the spine here. Good. As I run my fingers down her spine, watch what happens right when I get to that mark. It starts to swell and get orange peely right there. Watch. Right there. Okay? 1, 2, 3, 4, 5, 6. Hold on. 7. 1, 2, 3, 4, 5, 6, 7. Number 6. 7, 8, 9, 10, 11, 12, 1, 2, 3, 4, 5. S1 and S2. Yes?
Yes.
Okay. S2 left pelvis, T6, and now we need to check her neck. Here at the base, I'm just going back into extension. It's a little tender when I push in here, but this is all muscle. When I'm feeling her neck, the muscles are just guarding in this side. And as we get to the top here, on the left, right there, C1. Okay? Good? Good. Now, in extension, we're isolating the lower cervical. Good? Good. Now, in flexion, we're isolating the upper cervical. And tight. Do you see the difference there? When you go down this way is tight here, right there.
Yes.
Yes?
Fine.
Yes. When you go down this way, it's okay on this side. Yes?
Yes, okay.
Okay. So, C1, right there on the left. Now, look up, please. We're going to check your jaw, okay? You also have a little deviated septum. You want me to fix the nose too? We'll deal with it later. Open your mouth slowly. Open, open, open. Slowly close. So she has a classic left AITMJ, right EX. It does this. As she opens, it goes this way because the problem is there, and then it compensates on the right side. So the fix is we have to actually work on the right side first before the left side. We're going to start on your and then we'll tune up the rest. We're going to start on your C1 up top. From there, we're going to work on your pelvis foundation. Then I'm going to have you walk a little bit. Then I'm going to reach up. T6 is probably still going to be there, but maybe it's not, maybe it's less. Okay?
Okay.
But before you leave, everything should be 0. Okay?
Yes.
Stand up and let's walk. An overall.
I feel pain all time and difficult for walk.
Where? Left foot?
Yes, left here and here.
Okay. And you feel it right now?
Yes.
Okay. So you'll tell us what's different after, okay?
Okay.
All right. You ready?
All right then.
Let's do it. Have a seat. C1, ASL. Hands on your lap.
Руки на бедра.
Nice and easy. C1, easy, easy. That's a little bit. She's very flexible. It's not going to go there. We got to do it here. You're very flexible. A lot of yoga, you said, right? A lot of yoga?
Очень гибкая.
Hold on.
Вы
Yes.
занимаетесь
Step.
йогой, да?
Before running, but 1 year ago,
Mm-hmm.
She started yoga. Yeah.
yes, because my massagist says that stop running on the yoga and I
That's fine.
practice.
I'm not a fan of running, but lots of walking. Okay, go on your knees here. Bring your knees back here. Bring your chest here. Put your face inside. Come over on this side, please.
Here.
Okay? Yep. Now, bring this hand here. This hand goes down. This hand, one hand, right there. Turn your head towards me, this way. Bring your knees apart
Немного в сторону колени.
and tummy down.
И расслабьте живот и поясницу.
See. That's a home run, lady. Good job. There you go. Come up slowly and let's walk.
Вставайте медленно и пройдитесь.
Now, just from that, walk back and forth 2-3 times. It's going to feel a little weird. Have you ever had that before? Have you ever had an adjustment like that?
I had a little storm and have
Little dizzy? Little dizzy? Okay, stop for a second. Hold my hand. March in place. You did have breakfast today?
breakfast.
You ate food this morning?
Yes,
Okay.
apple and pineapple.
Keep marching. Close your eyes. Open your eyes. Walk towards. It's a little less dizzy now.
Yes.
Okay. Keep going. One more time. Now we have to do her hip. Let's go right side down.
Направо ложитесь.
That's it.
Yes,
Yeah.
ma'am. Head here. You're tall.
Oh,
It's okay. This thing is, just put your head here. Bottom leg is straight.
Нижнюю ногу выпрямите.
Okay. I got you the whole way, okay? I won't drop you. Come forward. Forward.
Вперед, вперед. Расслабьтесь.
This is ASIN, pelvis. Hmm? The reason why is we want to get the ASIN. Okay. From here, 1, 2, 1, 2, 3. I'm going to be right there. ASIN. You okay?
I'm okay.
Take a deep breath in. Blow it out. Gotcha. Home run. Give it a second. Come around, please. Come around, please.
Okay.
Swing your legs down. Let me just cover you. Okay. Stand up and walk. And now you tell me what's different.
Что поменялось?
Come over here. Let's watch the walk now.
And different feel here.
Better? Good?
I don't know. I feel it's different, yes. And
Making some movements?
making movements.
Good. Her walk is starting to change. Cool. Okay, madam, let's go back down over here. Actually, let's have a seat over here. Let me recheck you.
Присаживайтесь, мы еще раз посмотрим.
Right side or left side?
No,
Нет,
sit,
садитесь
sit.
просто.
I'm going to recheck with the scope, okay? So, move the hair out of the way. We had 15 points on the left side, remember? Now we have 3 or 4 points on the right. Things are shifting around. You may do a lot of burping, gas coming out, both ends. It's okay. Okay? It's all right. Blada,
Yeah,
what is it?
it's perfect.
Thank you. Blada, check it out. Come back. Look, this. Remember the puffy sacrum she had?
Yeah.
Is gone.
Wow. Yeah.
Pretty cool. Come back slowly. S1. How does that feel now?
It's better.
Yes.
A little bit pain
Sore
here,
or sharp
here.
in the coccyx
Yes.
down here. We'll check that last, okay?
Okay.
Last. So, sacrum is clear. Let's check the right side. Okay? Left side. There you go. Feet together.
Ноги вместе, стопы.
Up for a second. Stand up.
Пристаньте.
Okay. Feet together. Open and close the knees. Open, close. Open, close. Open, close. Right side only.
Только правой стороной.
Better. Left side only.
Только левой.
Still need to work on her sacrum. The final piece of the puzzle. Not bad. Stand and walk a few more times, please, and then I have to do your sacrum. You're smiling a little bit.
It's a
Okay.
new emotion for me.
It's what?
New emotion. And I feel move my head and here different feel.
Let's go face down over here. Bring your knees back. Knees
Не
back.
назад колени.
Назад, назад. Good.
Я их стороны.
Open. Tummy down.
И расслабляюсь.
So I didn't really touch the T6, did I? But it's tender.
Yeah.
Yes?
Yes.
Still pain?
Pain.
Okay. Let's
Time.
T6, shoulders down. Chin up. T6 as a PLS. Home run. Gotcha. Sacrum. S2, tiny bit more. Good. Good. A little bit more. That's it. Very good. Come on up.
Вставайте.
And let's walk.
Пройдите.
Shake it off now. Good. Walk on your toes.
На носочках. Пройдитесь на носочках.
Big toe.
Большой палец.
Yes.
All right. Let's continue.
Давайте продолжим.
Have a seat over here. I'm
Присаживайтесь.
going to work on your shoulders. Let me do the work. Right shoulder. Left shoulder. Ears.
Ouch. What it is?
Back, please.
На спину.
I'm going to use this board. The sound is the board, not your foot breaking, okay?
Этот
Okay.
звук будет связан не с тем, что ваша нога ломается.
More pain here, more pain here. Same. Okay. AS talus, medial tilt. Let's get a little bit more. There. AS talus. Gotcha.
Ouch.
Plus.
Без комментариев.
No comments.
What? Comment?
No comments.
Turn to your left side. Left side.
На левую сторону.
Okay. Calcaneus. Navicular. Other side, please.
На другую сторону.
Calcaneus. Navicular. Come over here. Let's work on your jaw.
Прям как походу.
Now go on your toes.
На носочках.
Better, right? Can you walk on your toes towards it?
Пройдитесь на носочках.
Better now?
Лучше?
Yes.
Good. Now the jaw. Look up. Ah. Okay. Open all the way. Ah. 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 Close half. Hold. No, no, no.
Нет, прикройте
Open.
наполовину и держите.
Hold. Stop.
Ouch.
Okay. Now we have to do the left side. Open all the way. Open. Open.
Полностью открывайте.
Open. Open. Open.
Полностью.
Slowly
И медленно закрываете.
close. Open. Open. Open.
Открывайте.
Open. 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 More. There.
Сильнее.
Close. Ah! Look up.
Наверх.
Slowly open.
Медленно открывайте рот.
Close.
Закрывайте.
Open.
Открывайте.
Open.
Открывайте сильнее.
Slowly close.
Медленно закрывайте.
Yeah. Okay. There's still something up here. Look. Slowly open
Медленно, медленно.
and close.
И закрывайте.
Open.
Открывайте.
Five. Now all of this is scar tissue, okay? That's gonna need to be worked out moving forward. Stand up, please. Squeeze my hand.
Жмите руку.
Squeeze. Elbow. Thumb. Squeeze. Squeeze. Good. Squeeze. Walk a couple more times.
Пройдите еще пару раз.
Разница в ощущениях большая, боль чуть-чуть отступает, за это я ее чувствовала постоянно и накатывались слезы во время ходьбы. Пока немного кружится голова, ходить стало проще, боль отступает. До этого я чувствовала ее постоянно при ходьбе.
Okay. Have a seat, please. Last check. Make sure everything is clear and she's good to go for today. Neck is clear. Your back is clear. Sacrum is clear. Back slowly towards me, please. Less pain now than this first time?
No,
No pain?
different,
Different pain.
yes.
What's different?
A little bit,
You're all set for today. Now, you're gonna go have your lunch. Okay? You're gonna go have your lunch and then you're gonna,
I can manage.
huh?
I can manage. It's
You can-
when? After 1 hour, 2 hour.
You can go eat
No.
right now if you're
Yeah.
you hungry.
Yes.
Go eat right now.
Okay.
Okay? If you can go grab something, come back and tell us how it was after food. Because we're still here for a little bit.
Yeah.
Okay. Thank you.
Thank you.
Any other questions?
Yes, I have questions. After our car, I have different my face because a little bit oops and
Mhm.
I cannot breathe because before I have this. It's
The clavicle?
yes, I have now on the pain and strong muscle.
Tight here. Okay. That's okay for right now.
Okay.
You had a lot of nerve pressure in the body. Your muscles were out of balance because of the spine being out of balance. Now I put it in balance for you. So what you do is go walk for 10 minutes, go eat some lunch.
Okay.
And then you come back and you tell us how this was. Okay?
Okay.